Good morning, guys. Tony Maritato here. Let's talk about scenarios in which you can, if you choose, you may choose to optimize your schedule for Medicare beneficiaries on a telehealth platform. And I think the telehealth component is going to open a lot of new doors for therapists out there. If you've seen any of my past videos on a similar topic, you know I love small groups. Like, I'm not a one-on-one therapist. I don't enjoy 60 minutes in a room one-on-one with a single patient. That's not what I do well. I love small groups. I love interaction. I love the energy in the room. So I tend to deliver a better patient care experience when I have a couple people around. In this scenario, what we're doing is we're saying, rather than treating one Medicare beneficiary for 4 units in a 1-hour time frame, which is typical, right? What if I did 4 Medicare beneficiaries, 1 unit each in the same 1-hour time frame? Now, obviously it's case dependent, obviously it's diagnosis dependent, and there's a lot of other components to this, but I just want you to understand, if you've been billing Medicare for any length of time, you've seen the damaging effects of the MPPR, the multiple procedure reduction. For my practice, if I do a single 4-unit session with a single Medicare beneficiary, I'm looking at about a 23% reduction from the allowed amount. Whereas if I did 4 single unit visits for 4 different Medicare beneficiaries in the same 1-hour period, I completely eliminate the 23% MPPR reduction. So you can imagine, from a revenue perspective, huge upside, but even from a patient care, patient delivery, patient outcome, so many of my patients are coming on an outpatient basis. I run an outpatient orthopedic physical therapy clinic. My patients are dressing themselves, bathing themselves, driving themselves. And so they just don't need one-on-one 60 minutes with a physical therapist. So let's take a look at the scenario from a telehealth perspective, because this is where it gets really exciting. For those of you who don't have a brick and mortar clinic, you're doing mobile, but you're still looking for a way to touch base with your Medicare beneficiaries. Imagine this scenario, and then on the screen behind me, you can see I've got a Medicare document pulled up with examples of how this system would work, and I'm going to translate this into a telehealth environment. So imagine you day one, you go to the patient's home, regardless, like those of you who are traveling 30-40 minutes to get to a single patient. This is a strategy that would absolutely benefit both you and the patient. Day one, you go to the patient's home. You provide a thorough evaluation. You do all of the amazing things that you do. And you set the patient up. You actually go through the process of initiating the telehealth consult. So the patient knows exactly what they're going to do, how they're going to do it, when they're going to do it. You test the technology, you make sure everything works, everything connects. You've got video and sound and all the stuff you need. Okay, so let's say this was Monday. You leave on Tuesday, Wednesday, Thursday, Friday. You do your 15-minute check-in. Each time you check in is through a telehealth platform. Each time you check in, you review the home exercise program. You progress, you teach them, you go through therapeutic activity-based intervention so that the patient starts to build some consistency, right? And the idea here is, you're not just doing one-on-one for an hour through a telehealth platform. That starts to get really tedious. But what you can do instead is you can have, and you're going to see the example on the screen, you can have patient number 1, right? You start your session at 9 a.m. Let's say all 4 patients join the call, the telehealth call, at 9. You start one-on-one with the first one at 9. The other 3 are going through their program while being monitored by you visually on the computer. If they run into an issue, if they run into a problem, they can put it into a chat. You're spending the first 15 minutes one-on-one with patient 1. Then from 9:15 to 9:30, you're with patient 2. Patient 1 starts to do their programming independently, but still being on the monitor so you can still kind of see what's going on. Patient number 3 starts at 9:30, goes to 9:45, and patient number 4, You do the wrap up 9:45 to 10 o'clock. In the 1 hour time frame, you've provided 15 minutes, a single unit of one-on-one service. The other 3 were doing independent activity, which they have to do anyway. They have to do their stretches, and they have to do their rolling pin massage, and they have to do some of the exercises that they already know. But they're on the video call with you. So if, heaven forbid, something goes wrong or you see something that's going on, you can kind of make a mental note with it. But you're one-on-one and billing for a single person at a single time frame. And so if we look at the Medicare guideline for what this would look like in real life in the clinic, what we've got in a 45-minute time period, therapist works with 3 patients. I'm talking 60 minutes in a 4-patient situation, but same thing, patient A, B, and C. So therapeutic exercise to each patient with direct one-on-one. Now, I would tell you, spend your time doing the stuff they can't do on their own, right? Let them do the therapeutic exercise independently. Do the therapeutic activity, which is progressing their function. So patient A receives 8 minutes, patient B 8 minutes, patient C 8 minutes. After the first 24-minute period, the therapist returns to work with patient A. So imagine on your telehealth call, you've got your 4 boxes, right? You do 8 minutes. It has to be 8 minutes of uninterrupted one-on-one time. But you go to patient 1 for the first 8 minutes. Hey Bob, how's it going? How did everything progress? Okay, awesome. Let's do this. Let's do that. I want you to really focus on, this activity. I'm going to have you do that for the next couple minutes while I check on the next patient. You spend 8 to 10 minutes focused on patient number 1 in the first time block. You've updated them, you've seen them, you told them what to do. Now you go to patient number 2. Patient B gets 5 more minutes, right? So we got a total in this example of 13 minutes. And finally, patient C gets 6 additional minutes, 14 minutes total. During these times, the patients are not receiving patients are not receiving the one-on-one contact. They each are exercising independently. And this is where I go back to us understanding our value, understanding the payer guidelines, understanding how to maximize benefit for both parties, right? So do I really need to be paid a therapist's rate to count to 10 3 times in a row? No. Now, of course, I know you guys aren't doing 3 sets of 10. You're doing far more progressive, active exercises, but that's a different conversation in terms of, is Medicare paying you for the highest quality exercise or paying you for the outcome? I really think that when you look at these numbers and you start to think about new ways, you forget everything we think we knew about how to deliver care, and you say, well, what can I really do? Like, what are my opportunities here? I can't see a better opportunity than saying, okay, I'm gonna bundle 4 Medicare beneficiaries. I'm gonna look at, and if you guys don't know, I don't know, CMS, CMS Physician Fee Schedule Lookup tool. Let's take a look at this real quick. Let's get in. If you guys haven't seen my video on how to find Medicare fee schedules, I'll put it up in the overhead card here in a minute. They still don't have the 2021 pricing. That's fine. Let's do this. Let's do this. Let's go 97110. 97530, 97112, all modifiers, and let's choose, I'm going to choose Ohio because that's where I am. And so you can see for therapeutic activity, functional training, I'm looking at almost $40 a unit. Now I can tell you based on MPPR, after the reduction, so if I did 4 units, remember, I lose about 24%. So in this scenario, I'm going to be losing about $7 and change, right? That's almost, well, I just said it's like 23%. I'm just trying to do math in my head, so don't check a calculator. But the idea is, If I did 4 Medicare beneficiaries, one-on-one, 15 minutes each in an hour, they're doing independent exercise between the one-on-one time, I am looking at upwards of $150, $155. If I do 4 units to a single Medicare beneficiary because of MPPR, I'm looking at something closer to $120, $115. That's a huge discrepancy, especially when you're looking at hours in the day, hours in the week, weeks per year, right? So I'm not telling you how to bill. I'm not telling you how to treat. I'm not telling you what you should and shouldn't do. I'm trying to share new models and new ideas so you guys can look outside of convention. You're already looking outside of convention by considering this kind of information, by thinking about what the opportunities are. This is just pushing you a little bit further to say, well, what if I don't? What if I don't treat patients who absolutely need 60 minutes of one-on-one time? What if I do see, Mrs. Patient down the road who just needs a couple sessions and some supervision? Maybe I can get into this market. Maybe this isn't appropriate for the market you're treating right now, but this market is absolutely out there and needs your help. Right? So I'm not saying to force this model on what you're already doing. I'm saying to consider this model as an existing model that you haven't considered and you haven't looked at working with. And we all love variety. We all love different things, right? So this is an opportunity for you to look outside of what you've already been doing to open up new avenues. So guys, think about this. Post in the comments below. Let me know what your thoughts are. Let me know if you have questions about this, because this isn't my concept. This is published by Medicare. This document comes right from, I think it was updated in 2019, comes right off the CMS website. This is the stuff that they are telling us we are allowed to do. Guys, as always, I'll catch you on the next video. Thanks for watching.